So we've done our 6-point spring test. We have gapped the PSIS posteriorly. Theoretically, we have more space to do a posterior to anterior mobilization on the sacrum. So with our assessment, we found that the right ILA had the hardest infill out of the 6. So how do we mobilize that? First, I'm going to lower the table a little bit. And then I like to use on the sacrum kind of a key grip to help to stabilize my thumb, because my intention is mostly posterior to anterior mobilization, okay? Some people can get away with using the kind of like the pisiform or thenar eminence there. I don't love that on myself, on my wrist. I actually like this better. There's also a tool, the snowman with the hat is a great tool to put pressure into this area. So if you don't know what the snowman with the hat is, ask somebody because I don't have one right now. But there will be on other videos. There will be one on other videos, I'm sure. So I kind of stabilize again with that key grip. I sink into that infill. I kind of clock around to see which direction is the hardest. And the hardest infill is actually kind of on this angle for her, but it could be any angle for other people. Is that okay, Kelsey? I know she has some sensitivity with compression at her L5, so I don't want to do too much compression there. But this infill is kind of in this direction. Now I'm going to bring her knee up, and I want to feel if I externally rotate her versus internally rotate her versus just do more knee flexion. And actually more knee flexion is what she needs. If I localize that a little bit into internal, it's really just for her. I'm just going to resist some knee extension here. So now I'm going to get my body in the diagonal that I'm interested in, because it just so happens that the direction that I'm resisting into is almost the same direction that my hard infill is through her sacrum. Are you okay with that? So I am sunk down to the depth that I need to be to engage that restriction. I take her knee on the diagonal that brings more tension or a harder infill into my treatment hand, and now try to straighten your knee out, and that goes right to my thumb. Good, and let it go. Nice. And I continue to as I take the slack up, I'm relocalizing through my treatment hand. Good. And then I relocalize through the leg right there, and then try to straighten your knee out there. And I'm blocking that sacrum, and it feels like it's actually just melting underneath my thumb, which is not always the case, but it is in this moment. Okay. Then I've mobilized that ILA. I'm interested, okay, I find PSIS again. I find sacral base, superior medial, still feels good. Mid-sacrum, there's a little hard infill there on the right. ILA actually feels like it loosened up a good amount on that right side. Left side's a little stiff, and right mid-sacrum is stiff, okay? So at this point, I say, okay, this feels better. Sometimes when you improve the hard infill at the ILA, some of the other ones will go away. In this case, they didn't. So then I would go to whatever feels like the next hardest infill, probably here. Work on that for a bit, reassess everything. And then if we still have the left ILA, then we would have to go back and mobilize that as well. But that's an overview of how we approach working on PA to the sacrum, working all the hard infills, not necessarily just the one. Sometimes the one clears all the rest of them up. Other times it doesn't, and you have to treat them, okay? So PA to the sacrum, give it a try.